All right, it shows that we are live. And I'm going to check my page really quick just to make sure that we are showing up. I see us. I see us. We're there. Okay. So if you have your phone, if you want to start sharing in your groups or with your people on your page, it doesn't let me tag. So if you could share it,
let me see.
Whoever's watching will be able to see on your page. All righty. All right, we'll get this show on the road. Okay, it's everybody's. Hey, Alicia, classmate. Hey, good evening, everyone. My name is Kitty London, host and creator of the People of Power Show. And every week I sit down with movers and shakers, CEOs, entrepreneurs, some celebrities, but basically people who are doing amazing things. And if you know these ladies, I would ask that you hit the share button. You may see the title. I'm not sure because Zoom sometimes shows the title and sometimes it does not. But I call this show the Lupus Awareness Show because we are in, is it here? Just make sure I want to make sure I'm right. We are in Lupus Awareness Month. Am I correct by saying
that? Yeah.
Okay. All right. Want to be politically correct. Want to make sure because I'll get people to say, you're not saying it right. You're not saying it right. Okay, I said it right. But anyway, if you know anyone, okay, if you know anyone who has been affected by lupus, if you are affected by lupus, please, like I said, hit the share button because we definitely want to make sure that this information gets out to our community. The good thing about social media now, nothing is a secret. And we know that people are not alone when it comes to social media now, nothing is a secret. Is that Roshan's phone?
Yes.
I'm like, where is that coming from? You can tell we are live, people. All right. But anyway, I'm going to go ahead and do a round table real quick to allow these beautiful ladies to introduce themselves, and then we'll get to the meat and potatoes of the show. And if you want to be interactive with us, I do see the chat. So if you will have any questions, you want to just give a shout out or just put your 2 cents in there, please. We want to make sure that we engage with you as well. So I will go with Kiera first because she's actually the first. This is her first time. Roshan, we've been together for, I don't lost count now, right?
With COVID, I know.
Right?
Yeah.
Okay. So I want to make sure that we get Kiera. So welcome, Kiera, to the People of Power Show. How are you this evening?
I am amazing. Thank you for having me. I'm Kiera Hester. I'm 27 years old. I reside in the beautiful city of Riviera Beach. And I am his warrior at the moment.
No, you are the first guest that actually gave their age. I don't know if you're going to start a trend on that one, but I'm just saying, everybody is not that vocal with their age, but I thank you for that. All right. Let's go over when you're young, Roshan, they just, they don't care.
I know.
When you get a certain age, you're like, listen, none of your business.
I'm not telling my age.
I'm none of your business. Right. I'm waiting for you to follow her. But anyway, Roshan, let's hear your credentials, please.
My name is Roshan Ridley McCray. I'm a primary care nurse practitioner and infectious disease nurse practitioner. I met Kiera and became instant friends, and she asked me to do this with her to give my knowledge, and I'm here open with her to follow her journey.
All right, get into some education factors. Hey, Prissy, good evening, ladies. I see the Purple Heart, and the Purple Heart stands for, is that something that's symbolic with lupus as well? The purple?
The color purple is because the ribbon is purple. So a lot of times if I'm making statuses, I see other, lupus groups or lupus warriors or survivors or caretakers that use the Purple Heart. So it's a symbol of support.
So this is, again, an education piece for people who are looking at it and wondering, where does the Purple Heart come in? And I like that you said the keyword survivor, because that means that people have not survived, unfortunately, this disease, and we'll get into that as well. But Kiera, you're very transparent. I know that you actually did some video biographies. You were in the hospital. People were praying for you. It wasn't looking too good at one time. I mean, you were transparent about it. So I want to just know, your story, And again, this is a learning process for all of us, and especially people who have not been diagnosed yet, because I feel like, we could have it and not know it. So can you kind of just give us your timeline, when you were diagnosed and just your symptoms, and just give it to us so we can know?
Well, to begin, I have always had aches and pains, but by me being heavy, I thought that's where that came from, and I'm always on the go. I was in college at the Bethune-Cookman University, and while I was working in athletics and being in concert chorale, I would always hurt. So I could be going good for about 2 hours, and then legs are swollen, feet are swollen, can't really move, stuff like that. So I just thought, like, I'm just tired. Fast forward to, I came home, I want to say this was 2017, and they, JFK North is the hospital that I was in, and they were under the impression that I had lymphoma. So I had to get, what's the term for it? I had to get a lymph node removed, I believe it's a biopsy.
Biopsy.
Yes, I got a biopsy, and they were just so sure that it was lymphoma. So I got the procedure done. I returned back to school against their wishes. They wanted me to stop. They wanted me to come home. It's kind of high risk. And I just was not in agreement. So I went back to school. I finished. I graduated. Fast forward to 2019. Now, between 2017 and 2019, I was in and out of the hospital in Daytona, in and out of specialist doctors, just trying to figure out what exactly is going on. I've been told to start off, it was lymphoma. I've been told it was just the flu. I've been told it's probably arthritis. I've been told a lot of things. And so in 2019 is when I had a major flare. Well, what I know now to be a flare. So in May of 2019, I got so sick that I called my mom and I told her, I don't know what is going on, but I need to come home permanently. And that phone call coming from me was something that just didn't sound like me, because I was one of the ones, I'm never moving back home when I go to college. Like, oh, I'm back to Palm Beach? Oh, no. So I called my mom and I was crying. And I just said, something is wrong. I need to come home. So I came home, went into the hospital, and it went down here from there. I started in JFK North. I ended in JFK South, which is the main JFK campus. And on Father's Day of 2019, they came in and diagnosed me with lupus. So my rheumatologist, Dr. Juan Maya, he came in and told us the news, and I was very down about it. I cried, because at that moment you just think, have I done anything wrong? That is this punishment? Is this a death sentence? So I was very in my feelings about it. I was not open to talking about it, support groups, anything like that. It was just coming into that moment. And so from 2019 to 2021, I have counted, I believe, if I'm accurate, I've been in the hospital about 11 to 13 times. Where Dr. McCray comes in, that is, I also contracted shingles. And while I was in, I believe it was Palm Beach Gardens.
Yes.
Okay. I contracted shingles, and I had no clue how painful shingles was. It started off as a little rash. It turned into a rash that covered majority of my body. So I would say I know we're pressed for time, but I would say, to sum it up, lupus is a chronic autoimmune disease that's big on inflammation in your tissues and your organs. And for me, lupus has affected my heart, my lungs, my kidneys, my skin, my muscles, my joints, my teeth, believe it or not. And so I would say today, and people don't believe me when I say it, lupus actually saved my life. Some people will say, why would you give credit to a disease? Although it comes with a whole lot of baggage that I will have to deal with for the rest of my life, it slowed me down from doing things I were not supposed to. And what I mean by that is not eating healthy, always being on the go, not resting, not taking care of myself, always concerned about everyone else but Kiera, making sure everything else get done but things for myself. So I give credit to lupus because it slowed me all the way down to focus more on Kiera. Kiera became the prime focus with having lupus. Right now, I'm not back to where I would like to be, but I am better than I was. I have 2 nodules in my lungs currently, congestive heart failure. I can walk a short distance and I'm gasping for air, or you get fatigued probably 23 hours every day. So people see, Kiera still is in the glitz and the glamour and still doing her thing, but there are times when I'm depressed. There are times where I just cry out of nowhere because sometimes I'm still in denial. There are times where I text my mom or text my dad, why me still? Even now that I know over the course of the years, it was lupus all of this time and we didn't know, I still have the why me moments. Every time I get my hair done, still to this day, I cry. When I take the weave out and I'm used to my natural hair being down my back and now is 80% gone, I cry. So I would say in a nutshell, lupus, no one has the same case of lupus. Asked my doctor, what category do I fall under? Because there are 4 major categories of lupus. And still to this day, he cannot fit my symptoms into one category because he told me I'm a unique case. So that's where we are as of today. I'm a lupus ambassador. I'm getting my organization off the ground called the Butterfly Effect, but it's pronounced the But Her Fly Effect. And I just am on the mission to uplift somebody else like me. And I feel that when I begin to tell my story to people, it can help someone else because lupus, although it's a physical thing and it's an emotional thing, you also go through the mental aspect of it. And so it's just a coincidence that Lupus Awareness Month falls in the month of May, as well as Mental Health Awareness Month is in the month of May. Those two go hand in hand. And if it wasn't for nights God had to come and speak to me, because I would literally sit in a room all night and sing to myself. And if it wasn't for my care team, and if it wasn't for my village, I wouldn't even be able to sit here and tell the story because my biggest thing was crying. And Dr. McCrae can attest to that because she's seen the good, the bad, and the ugly.
Yes, I have.
So that's
what shocks me, because I know I'm listening to the story and I'm sorry, I'm a hypochondriac. So I'm usually a person, when someone says they have something, I immediately start feeling the symptoms. I'm what they call it, symptomatic, whatever. So seriously, right? And I'm thinking, because I'm like, well, you get over 40, your joints do start aching. You start having issues. You can't stand up long. Sometimes you do get winded, especially if you gain weight. So I'm listening to your symptoms. I'm like, gosh, that is so many people, right? That walk around and just think, like you said, it could be rheumatoid arthritis, it could be gout, it could be I mean, there's so many things that have those symptoms, but when you said lymphoma, that kind of took me back a little bit, because when I had a dog that died of lymphoma, so I know it's a very aggressive cancer that affects your lymph nodes. But I'm just trying to figure out, because I know people are like, oh my God, like, what do I have? If they're like me, where was the connection between the lymphoma with you? Because you said you were swelling, right? How did they come up with that at first? Because that would take me out. Just, I'm telling you, I'm like, I couldn't even hear that. Just wouldn't even want to know. But can you kind of elaborate a little bit on that?
Sure. So the medical doctor came in and they ran a series of tests. When they ran, they did the biopsy and they did another, I can't really recall the exact test, but that's where they assumed it was. That was in
From like the blood work and the tests that they came back. Okay.
Correct. However, my rheumatologist compared the blood work from 2019 to the exact test back in 2017 and told me it was read wrong. So I had lupus in 2017, but due to the review of the blood test in 2017, it was missed.
So we need some medical experts right
now. Can't hear you. Okay. I hear you now.
You hear me?
I hear you now.
So we need some medical experts right now. So Roshan, Lord, that's a lot. That's a lot, because it almost reminds me when we talked about COVID, how it was so many symptoms are so similar for people, right? It's like you can definitely misdiagnose yourself just by reading symptoms on the web. So when people look at the show and they say, you know what, half of the symptoms that Kiara just mentioned, I am also, experience this. I get the swelling, I get the aches and pains. I get the other things that people may have. And I know sometimes, like you said, it can be different, because I know people with lupus and it affects their skin, affects them the outward. So I don't know, again, how many different, like you said, 4 different stages and which one they come in, or how one is worse and one is not. But I don't know. So you can educate us on that as well. But for me, my most thing that I want to get out is, if people watching the show and they say, you know what, I'm experiencing this. I need to be an ambassador for my body. Can you kind of break it down for what are the red flags that people may need to say? I need a blood work, or I need a more extensive case of blood work to my doctor.
Well, first of all, with lupus, it is unknown cause. We don't know where it comes from, the etiology of it. And the risk factors can be genetics. So one thing you definitely need to know your genetics in the family. It can be hormonal as well as environmental factors as well. Some of the main signs and symptoms that we have, it mimics so many other autoimmunes. That's why it's kind of hard to diagnose. Like I was asking Kira before we came on, the average person takes them about 5 to 6 years before they actually diagnose them with lupus. They have everything else. One of the signs and symptoms that you have is fatigue. 80 to 90% of people with lupus are fatigued. And how many diagnoses go with fatigue? So many of them. But with that, the fatigue, you also get fevers and chills, recurrent fevers. You get heavy sweating at night. What that could be? Menopause. I think you're going to menopause. But the onset age for lupus is 15, youngest teenager, 15 to 40, 44. That's the onset age for it. She had said about her company gonna be butterfly rash. That's one of the main signs you get. It's called a malar rash. It's a butterfly. It's like here, the face like a butterfly. And what it does too, when you have that, we call the nasal labial folds. Like you fold, like when I smile, you see my folds here. When a person with lupus, when that butterfly rash, they don't have that. So a lot of times you can look at a person, they won't have this smile like here, the labial folds, they won't have that. You can also get the discoid rash, which is shaped like a disc. And this rash is flattened, but it can be raised too on your face as well. And the thing she was saying too about her weave, alopecia, it causes a lot of alopecia. And a lot of times it's patches, spots in your head, you get a lot of patches, it leads to scarring. That's what that does. And one thing too, with lupus, sun sensitivity. It really affects your skin with that sun. And the main time they tell you to be out, not in the sun. I think Tierra can test for this from 10 a.m. to 4 p.m. We try and tell our patients don't be in the sun as much as possible or cover up. You need to cover layer yourself up also. One thing too, you can get the ulcerations. Ulcerations can be in your mouth. You have it here, and it can be in your nose. They are painful, but they are there. The one thing too with all the pain is the polyarthritis with lupus. That's the main thing. And with the polyarthritis, poly means many. Ortho means bone, and itis means inflammation. So with this here, you have the pain, inflammation of multiple joints. It could be with the lupus, most of the time it's 2 or more joints is required to be often at time, at least 5 can be affected at one time. So you could have your knee, and your knee can hurt, and also as your wrist and your hands. And it also be symmetrical distribution. Symmetrical means if you have pain in that right knee, you will have pain in that left knee. If pain in that right wrist, you have pain in that left wrist, the same thing. And also it affects the large and the small joints at the same time with lupus, but also it mimics rheumatoid arthritis too. But the rheumatoid affects more of the small joints affected versus that. That's why it's very hard for us to get, that's why when the patient come in, they have to do a really thorough physical assessment, and the patient have to be honest with their doctor and tell them the truth, what happened. The symptoms you have also, you got to make sure you do that. With the swelling and the joint effusion and tenderness you have, morning stiffness you have more than an hour. Same thing like rheumatoid. It's painful at night, but they improve with activity, or sometimes the joint pain worsen with rest. Also, you can have weight loss. You can have weight gain, or you can gain weight as well. A lot of times it's anorexia. You don't feel like eating, so you have a lot of weight loss. With the her heart, it affects your heart as well. You can have the pericardial, which is the inflammation of the pericardium, give you chest pain and the shortness of breath you get from that. I think it's, she was saying different type of lupus you have. Toni Braxton has the pericarditis lupus. That's what she has, that one there, because remember she had the pain. Nick Cannon, I think he have the discoid more loose with the rash. That's the one he has. And Trick Daddy, he has discoid lupus also with the rash. He has that one too. And he's very open about his diagnosis as well. Endocarditis, that's the inflammation of the endocardium in the heart. It can affect that. But with lupus, the main diagnosis for the heart, I don't know if she was diagnosed with this here, but it's called the Lippmann sac endocarditis. And that's where a lot of time infectious disease come into play. Because when a patient come in the hospital, they have a high white count. Then they'll consult us because they don't know why the patient got the white count. And I do a test called an ANA, which is an anti-nuclear antibody test. I do that. If that's negative, I say, well, no, I have to do like other tests. I have to order 2. I have to do the viral panel as well from ID. You can also have a headache, which is intractable headache. It's constant there. And you can have peripheral neuropathy, which is numbness and tingling sensation in your extremities. And a lot of times, some people have what they call like a Raynaud's phenomenon. It's white and red, but it's very numb. And they always be cold all the time. And another one you have is called lupus nephritis, which affects the kidney. A lot of patients end up on the dialysis machine with lupus. I have had several patients. When I was in hemodialysis, I saw a lot of African-American women that had lupus. That's why they was on dialysis due to lupus. And also with lupus, you can have lupus and rheumatoid arthritis. I have a patient now in the hospital. She got both of them. She's on dialysis. She's in her 50s. She got lupus and she had rheumatoid arthritis. When I go in her room, I just want to cry because she's in so much pain. It's just horrible. But this lady got a good spirit. She had a good spirit. And she just keeps fighting. You just got to keep fighting with this here. One thing too, a lot of time with lupus, you can have a lot of pregnancy losses. They see more pregnancy loss in the second trimester because what they call increase during that time, you can call complications because of they call hypercoagulability. You form a lot of clots, and you miscarry the baby. To increase the risk for create the clots there. That's the main symptom that you have, that sign and symptom that you have. But like I said before, it's very hard to diagnose this here because you got to do a very thorough assessment go to your primary care doctor. Then once you go to your primary care doctor, and once you tell him the truth, everything you have, they will refer you out to a specialist, rheumatologist authorized for the treatment for you. They'll refer you out to him. And that's the main thing you want to do. And like she said too, you can also get the shingles. Like she had shingles, she didn't know what it was. And that shingles is very painful. I mean, she was in so much pain. I just felt so sorry for her. But when I came in out and I threw her covers back and told her to take her blouse off, and I looked at, I told her she had shingles. She was like, oh my God. She just started crying. But I said, you will be okay. And I think you stayed in the hospital like a week and a half, almost 2 weeks. She stayed in with me. But she still had good spirit. And she would cry. I would see the pain that she was in. And I come in, I would do a little dance for her, trying to make her smile. Me and the other nurse practitioner would come in and do things like that for her. But it's just hard. It's just hard to see her. Then I just love her spirit and her attitude about the lupus. So I even told her she needs to be an ambassador. So I would definitely support her in everything she do in this journey with this lupus. Any other question? You're welcome.
God. Like you were on 30 minutes of symptoms. My God, that's a lot.
It's a lot. It's so much you got to do. And being an ID, infectious disease, we have to see the whole picture, because I remember this one doctor said he didn't want to go into ID because we was in med school. They always told him, send the ID. And everybody coming there, they send everything to us. So you got to sit there and figure out what's going on with this patient. It can be, I like ID because it's investigative. You investigate things. So it's kind of intriguing to me. So I like to try to figure out what it is.
I bet you after this show and people see this, they're probably going to want to get tested, because it's like, you said so much stuff, literally. Like I'm thinking of, like, I have my own checklist, and I mean, you know, I'm 45 and I'm like, well, good God. Like
that's not have.
It's a lot, you know.
It's a lot you gotta look into.
I think Ellen DeGeneres has it too, if I'm not mistaken.
I know Tony Braxton. Yeah.
And I'm not going to say that people look bad with it. I'm not saying that's what I don't want people to think, but I'm like, they look good. Like they look like they're living great lives. So, you know, but what Kiera went through and what you're talking about is, I mean, for me, if I got diagnosed, I would be like you said, Kiera, like, is this a death sentence? Because that's a lot to deal with on one body.
Yeah, it is. It's a lot. And like I say, people look at it, like you say, you look at people, you might look at Kiera, she looks happy, she looks good, but she is so much fatigue, she is so tired. So a lot of times they don't feel well at all. And you can see it in their eyes, you know. It's just a horrible autoimmune disease that you have. That when you have lupus, you hope you don't have nothing else with it. Like I said, if you get lupus and rheumatoid arthritis together, that's very painful. You in pain for days and nights, you know, coming out of that one.
So Pierre, how do you, I mean, obviously this has to affect your mental, I mean, and mental affects physical, because stress. What are some tips like for people, or, you know, some advice for people who are newly diagnosed with it? I know you haven't had it for long, but you've had it long enough to know what you're going through and that you're going to get through this. Obviously you're an ambassador for it, and you've had some dark days and you've had some good days, but people who are just now facing that sentence of, hey, I have lupus. I don't know if I'm going to make it. I don't know if this is going to be the end or not. What would you say to people that are thinking that way, who are just newly diagnosed with it?
Find something that makes you happy and busy. That's working. Working makes me happy. And even with my previous job and the job that I have now, I love working. So when I'm in pain, I'm at work. When I don't feel good, I'm at work. And they know, just let her be, because that's how she's coping. So I would say, find what makes you happy and bring you peace, because stress and lupus is so crucial.
Yes.
I recall being in a hospital, and Dr. McCrae can attest to this. The days that I stressed, my shingles spread it.
It did.
When she told me to stop stressing, and her and Dr. Stephanie came in and they literally had to dance and get me to get my mind else, we seen a decline. That's how shingles had worked. Like, stress can literally make or break your case. You just can't do it. When I stress, my eyes bulge, and I mean literally they look like they're about to come out of socket. And I would say find something that makes you happy and bring you peace. So if that's drawing, coloring, cooking, for me, apart from working, singing, I can sing. So singing makes me happy. My
Let
mom.
me find out you can sing.
She can sing. She can sing. She got a beautiful voice.
In the hospital too. But my mom has videos of me just laying in the hospital bed singing to me.
And you mentioned too about diet and lifestyle, because I know that plays hand in hand too. And I know sometimes when we're not happy about a situation, we do things to numb ourselves, right? We're being very transparent here.
Yeah.
People do things. So, even on a medical advice, Roshan, people want to drink their pain away or do other drugs to, don't feel the pain anymore. Like, what do you, as for advice, what do you have to tell people like that? Because I think personally that would probably make it worse. I mean, with all because you think about it, right? You already have this. Now you're adding on this that can give you this and this and this and this. So where you think you're band-aiding a flood, you're not, right? So what would you tell people who I'm just going to drink my pain away or, do drugs and I won't feel any of this. I don't care anymore.
Well, to be honest, because I'm very transparent, I do drink from time to time. Like I might go to Taco Tuesday and have a margarita or something like that. I will say your limit will change. So people out the door that just think, okay, I'm feeling good. I was sick on Monday, but I'm feeling good on Tuesday. So I'm going to have 2-3 margaritas. No, your body will shut you down. I will say for me, margaritas and cute drinks used to excite me. It's slowly being a thing of the past. And that's big for me because strawberry margarita, sugar rim is okay. But it's starting to become a thing of the past because now, for me, it speeds up my heart rate. It makes me tired. It does a lot of stuff to the body, and actually it takes you longer to come back from drinking like that. So I would say your body will know. As far as the diet is concerned, that's hard because some doctors will tell you go vegan. Some doctors will tell you limit your protein or do, only seafood or turkey or chicken or only do, don't do pork or don't do beef. It's hard. You have to listen to your body. I wouldn't say just go completely vegan because
did she get off here? Is she still there?
Hold on, let me see.
Let's see. Is she there? Did we get off the thing?
She is off, I believe.
Oh, let me see here.
But we're
still on. She's off, but we're still on. I don't know.
She said she's coming.
Okay. Okay. I was like, what is that? You're doing great. You're doing great.
Thank you.
I love the transparency.
Oh yeah, I'm very honest. I have to be.
So
we'll wait on her to come back.
Okay. Okay, she should be in there now. You see, I don't see her come back in. You see her come back in?
Not yet, but she commented on, she's in the chat.
Oh, okay. Let me see her, because I didn't chat up.
What I'll do is I'll just keep going and then she can pop back in. So
okay.
Going back to the diet piece, you will kind of have to do what works for your body. I would say fried foods are your worst enemy.
Yes.
Alcohol is your worst enemy. I'm just being honest about it. I'm not a smoker, so I don't know how smoking affects your body or how you feel, or lupus. I'm not a smoker, never have, never will be. So my doctor has suggested medical marijuana. That's that I'm not interested in. So I haven't explored that avenue. But as far as eating and dieting, I love, now I'm a big lover of protein shakes. So I finally get like whey protein or any type of protein in my smoothies. I'm a salad person now. I love a good salad. And there are alternatives to what you like. You just have to find them. So I would say on the diet aspect of it, you just kind of do what works for you, because if you go without the protein and that's something that you need,
right,
you can't really go completely vegan. And even if you do meat replacement, sometimes you have to be careful with that stuff, because although it's a meat alternative, it could be higher in sodium.
Exactly.
It could be higher in a lot of things. So you just have to just do what works for you. But I would definitely say anything deep fried to a golden, or anything like that, you should limit or shy away from. And rice, and pasta, your worst enemy. About lupus. And that was a big one for me. Rice is a big one for me. Pasta, I could do without it. But bread and butter, rice. Oh.
Did you see any food that probably aggravate your pain more than others? Did you notice anything in your food? Did you eat anything that would aggravate your pain?
I would say fried foods.
Food more.
Fried foods will definitely aggravate your lupus. It will you will definitely end up in a flare. Okay. I was fried foods and sugar.
Okay. What about when you experience more pain, in the morning or at night? Or can you differentiate?
For me, it depends on what season we're in and what outside feels like.
Exactly. I
would say I've experienced most of my pain at night. Sometimes it feels like I'm laying on concrete bricks. And I haven't had it as much since I've changed my diet tremendously. Right. But my hands used to twist, my fingers used to twist and stay there for a period of time. I've lost my vision one time, but as far as the laying down, my pain in the beginning was more at night, but it depends on what's going on outside. So if we're sunny South Florida, I might be a little pain in the morning, but I'm okay. If it was sunny at 9 o'clock and it's raining by noon, I'm in a whole lot of pain.
Okay, gotcha.
I'm back. I was looking cute. I was like, look at the co-host. Listen, when I tell you, I'm sitting here and the power just went whoop.
Oh, that's nice. Where'd she go?
Are you kidding me? So, the good thing about this format, it keeps you going. I'm texting. I'm like, what about the foods? Go ahead, girl. Y'all look good. I'm co-hosting. Y'all did perfect. Listen,
thank you.
When you're in a live environment, I tell people, even on the news, things happen. You got to just keep rolling. Listen,
yeah, exactly.
We do what we do. But I did hear about the fried foods, which is like, ooh, I love that. But what I wanted to know too is, like, for people like realistically who, especially because it does affect mostly women. And I know we had that on-off conversation. Like you said, 1 out of every maybe men can get it.
10 to 1, 10 to 1 women. Yeah, 10 women to 1 man have it, the ratio.
So if you're a young woman, like, because I mean, 15 is pretty young.
That's young.
Really, you're really starting out. So I mean,
Yeah.
for people that want children, I know that people who have lupus do have children, but is that something to consider? Because I would hate for people to say, I have this disease, I can't have kids. I mean, that's like one other thing that people may feel depressed about, but you can have children with
Yeah,
it.
you can still have kids.
You're just what they call become like a higher risk if
Yeah,
you have
exactly.
kids.
Exactly. You just got to make
Okay.
sure you monitor it with your rheumatologist and your OBGYN. They'll make sure everything's good for you.
I just want to put that out there because I think, especially when we get something very early, it kind of is like God, like, we have so much going on. We want to have a full life. We want to make sure that we can produce, and sometimes we can. And there are other alternatives though, if you can't. But I just wanted to get that out there just for women who may be looking at the show and like, because Kiara,
someone just asked
kids, Kiara, you don't have kids, do you?
Someone just asked in the comment, when should kids get tested? There's really no test for lupus. You just got to have the symptoms. Then like I said, you got to do a thorough workup from your primary care doctor and your rheumatologist. There's no lab right there. We could say one test gonna say you have lupus. I'm gonna do a CBC, always shows lupus. It don't work like that.
Kiara's eyes got big when I said that she have kids. I'm like, do you have kids, Kiara? You have
No,
kids?
no.
She's like, no.
No, she'll have a kids. She'll have kids.
But if she wanted kids, she could have kids.
Exactly.
That would be her. Yes. So I want to just, like I said, put that out because I do know people that have kids, and I don't want people to feel like, oh, I can't have children, because I know people who have sickle cell.
Right.
And, when you hear that, like I have the trait. And I know when I didn't even know I had the sickle cell trait until, back in the day when you got pregnant, they genetically test you and it's like, oh, I got this, really? And it was like, oh, you have a 1 in something chance if your child has or the father had. And I was scared my whole pregnancy because I was
wow. Well,
right?
thank God.
No, thank God. But those are the things that we have to face. And, we just have to have these conversations. But I'm just at awe. I think you're beautiful, Kiara. I'm happy that you made it. I remember, like I said, those videos. And I know sometimes people may say, why are people in the hospital doing? I see that because I see people saying that.
Yeah.
But I think to me, being transparent in your most vulnerable moment is really what makes you special. Because I think when people hear about these diseases, they don't really know how serious it is because so many people put on great fronts. Like you said, you put on the lashes and you put on the weaves and you go out and you look pretty and you drink your margaritas, but they don't know, right? When you come home, you're like, oh, gosh, I feel horrible. And I know, and I always used to say, if I got cancer, I would be okay. And the reason why I said this, because I know when people get chemo and have radiation, most people lose their hair. Like that's the biggest thing that they lose. And a lot of people don't know that people who are affected with lupus, their hair is extremely affected. And it doesn't, like I said, I guess maybe not every case, but a lot of cases. And for some women, that's everything to them. That's their crown. And for me, I would be like, I'm okay. I wear wigs anyway, right? I hide my hair a lot. So I would always be, seriously, I always said that I would always be okay if I lost my hair, because one thing about hair, we can always buy it. We can draw on our brows. I mean, we do it anyway. We have them, we draw them on. So I'm just trying to bring light to, things that people feel like, oh my God, if I ever got this, it's the end of the world for me. And it's not. Like, people like Kiara are showing you in their darkest hour. Like I was scared to get shingles because I had the chicken pox. And I know that they say, if you got the chicken pox, you can get shingles later. Like when you're 50, that's why they tell you to get the vaccine. Right. And here Kiara looks beautiful and she's had the shingles. So I know it hurts, but it doesn't make me as scared anymore because I'm like, well, you got through it. So this is why people like this need to come out and talk about things, because it gives other people a sense of hope that we can make it. I still don't want shingles though, but I think I'll.
Trust me. And for me, it was unique because I've never had chicken pox. So
I did twice.
I don't know how it feels to have the itchy and but with shingles, they have to get worse before they heal.
Yes, unfortunately. Yeah.
And I probably ran Dr. McCray crazy because once she had me on this bed, look, now I got to tell her, y'all, once she had me on this bed alarm. And so I would try to stand up, it goes off, right? I had 2 IVs, one in the left arm, one left hand, and one in the right arm. And then on top of that, I have shingles going up my left arm, across my back, my chest, up. And it was like, okay, Dr. McCray, what do you want me to do? You don't want me to get up, but it's painful laying back. So this should say, well, sit up and put a pillow on the back. I can't. Because if anything touches those shingles, it is a pain that you cannot even describe. So, and then they have to blister. So then while you in pain, all these little minute blisters have to open and have to burst.
Then crust over.
And then when they crust over, it's like the old folks say, won't it be a happy day? Because when it crust,
exactly.
it's like the pain is like, okay, now I can see clearly now the rain is on, but I don't wish
things we never thought we would be excited for, right?
She wanted to go home. Can I go home?
Listen,
Nope.
And I'm not being shady, but I must ask, because I know you mentioned too, Kiara, you were talking about you were in the hospital and you were in pain. And then you mentioned, Roshan, about a patient who had both of these things, right?
Yes,
and was in pain, like rheumatoid and lupus. First of all, why are you in the pain in the hospital? Like, don't y'all got stuff for that? Like,
well, yeah.
look at Kiara's face. I'm like, I'll be calling a nurse every 5 minutes.
Her pain is chronic. Chronic pain forever. Chronic is there forever. It's like, you got both of those. So she got medication for it, but she's still being pain. You don't completely go away totally.
And actually, I thank God for having Dr. McCray and Dr. Stephanie. Got to give a shout out to Dr. Stephanie. That's my pain management doctor. But because we're facing such a major opioid crisis, it's kind of hard that when you have a flare up and you have to be admitted, it's hard to get pain medication, one, because most doctors and most hospital facilities do not know what to do with lupus, or they don't understand it. So they don't understand why this young lady, and I keep using my age because they kept using my age in the hospital, but why this young lady, 27 years old, is in complete pain, and the first thing she asks for is pain medication. I've had nurses tell my mom that we need to do a screen for narcotics because they thought I was high or coming off of something. No, you are in extreme pain. And so I would say to anyone listening that knows anyone with lupus or battling lupus, get pain management, get a management doctor, because I learned through having doctors like Dr. McCray and Dr. Stephanie go to hospitals that they have privileges to. So whenever getting you to a comfortable place is ever up for debate, your care team comes, Dr. McCray got everyone in line.
I do.
Like, hey,
I didn't play.
what's gonna happen? This is what she gonna take at this time. Don't offer her nothing else. Don't scan nothing else. Don't even go in there and ask her anything else. This is what's gonna happen moving forward. Any questions, y'all call me. So I would say definitely get a team, a care team that you are comfortable with speaking on your behalf, because they will not. And I mean, eventually they will once they consult with your care team, but just right off the bat, giving you heavy pain medication, they will not. So you will have to be in pain sometime, because to them, if they don't know about lupus and they don't know the severity of your pain, it's like, we're not going to give her any hard narcotics because she's in pain. No. And then I'll also say, be careful with taking medication. Because I, to this day, sometimes I tell my friends or my mom when I'm in pain, just take a pain pill and go to sleep, or take something to go to sleep. Sometimes I deal with the pain, and I know y'all like, oh, she crazy, but sometimes I do, because you don't want to get addicted to the way that you feel. Because I've had, well, for better word, I've been exposed to many different opioids. Some of the lower grade opioids don't work anymore because I've been taking them for so long. So in the hospital, I think it's the one that start with a D, Dilaudid.
Yes. Mm-hmm.
As soon as they put that in my IV, I said, "Ooh, whatever that is, I don't want any more," because I went from up and talking and smiling to, like it was an instant hit. And so you have to be careful with that. But I would say definitely get the right representation, because lupus is so underrated when it's actually more common than heart attacks, strokes, and HIV. So I say get your care team.
Lisa, she was saying RA is horrible.
Yes.
I know we have a lot of people in the chat, and thank you for holding it down, Avis. She is typing away. Thank you. I know, to have that backup, that medical backup in the chat. But, I love that you said in regards to pain medicine, because so many of us, we self-treat ourselves, right? And I was talking to another person offline, and we were talking about, like, for women that have bad menstrual cramps or just bad, just aches and pains, and we go straight to that bottle of ibuprofen. But sometimes we do it so much that we create other problems like ulcers. And a lot of people right now are faced with, I don't know where all this acid reflux is coming from.
From all the medicine you were just talking about, those cause that, yeah.
And
Advil, all that cause that stuff, like that. Motrin cause the acid reflux.
Wow. Because I know so many people who are suffering from acid reflux right now. It's like, where is all this acid coming from? And I'm like, is it the food that we're eating? I know you should, like, they tell you 3 hours before you go to bed, like, don't eat. Because we get tired. We're like, oh, and we get itis. We love to say that. Oh, I got itis. So just lay down on that Thanksgiving dinner. Then got to go to the emergency room because it just sits there. But you were saying something, Kiara, in regards to that?
Ibuprofen is not your friend. So that was my go-to. Whenever I would flare or swell up before I knew I had lupus, ibuprofen 800 milligrams was my right hand.
Yes.
But ibuprofen is not your friend. Once I've learned about it, it should not even be given, really. I would say if your pain, if it's something that you can tolerate, Tylenol is the safest.
Yeah.
But that ibuprofen, no, ma'am.
So Tylenol gets rid of pain.
Yeah, Tylenol does.
It get rid of cramps.
Yeah.
And she's like, the extra strength. No, because really, ibuprofen is like our go-to, and I'm glad you did say the 800 milligrams, because that's what they give out. Dentists give out, everybody give it out. 800 milligrams.
It can cause GI bleed also with the anticoagulant. It causes GI bleed, so you got to be careful, especially a lot of older people. We see that a lot in the older people, because ibuprofen and Motrin is good for pain. It stops it. So you have a lot of older people that take 800 milligrams every 6 hours. Their pain is gone. Next week, they're in the hospital with GI bleed. They're bleeding because it's an anticoagulant and causes you to bleed. So,
wow.
Yeah, but even with acid reflux, you got, cigarette smoking can cause that reflux. Alcohol can cause reflux. Medication that you're taking, certain medications that you take can cause reflux. And we know food also. So
certain food.
And also, when you get older, our body just changes. A lot of stuff we can't eat no more. Because once you get over 50, it's like, I can't eat that. Oh my gosh, look, eating this, but now I can't eat that no more.
I think you need to drop that bar a little bit, Roshan. I think 40. 40, I think, is the new 50 for everything. 40 is the new 50 when it comes to aches and pains, because everybody I know in my class bracket complains about when it rains, they know those knees go to talking.
Got the arthritis.
That back go to talking, those shoulders go to talking, and then wearing certain heels. Ladies, certain heels we know we can't wear for a certain amount of time. You go to these events,
I know I can't.
Got to put your slippers on.
Mm-hmm.
It is what it is, but and we joke about it, but these things are real and people go through it. I think more of these conversations, I know we're talking about lupus and this is a primary conversation, but just the health and wealth of our bodies. I mean, we need to have more conversations about this because we don't talk about it enough. And there's a lot of people that suffer in silence.
Yes.
I don't know why.
Yes.
Maybe they think they're not normal, or maybe they don't want to know what's going on. I know some people are in denial. They're like, listen, I'm not going to find out. I'm okay. Be like, no, you're not okay.
No, you're
right?
not.
If you're in pain every day.
Yeah. In the future, I'm going to come over here and speak about where I see a lot of people, a diagnosis that never talked about, but they're in the hospital all the time with urinary tract infection. Yes, we got to come over.
Back in the day, we used to hear if you didn't wipe right, you got to be UTI. That's not.
Well, I'm going to come back on here. I'm going to give you a whole thorough thing on UTIs. I just realized so many people, even young 20-year-olds, coming there with urinary tract infections.
Don't drink enough water.
Exactly. People don't drink water. And water is your best friend. Water is your best friend. I tell you, I know older people don't like drinking water. I don't know. Maybe by the time I get in my 80s, I won't drink water either. I don't know. But they refuse to drink water.
They don't want extra. They don't want to have Pampers. I know why.
They don't want to pee, and they don't want to go to the bathroom. So it's like,
but depends either. They can't get up fast enough. Let's keep it real, because if you
come back in the hospital every month for UTI, like okay, the same thing.
So let's do this, lady. Seriously, hold me to it. Seriously, I don't care if we do it like every quarter, and we can invite other people. Let's talk about these health issues that affect us. Because it needs to, these conversations need to be had, right?
I will.
I said, no run lupus, but there's a whole ABCDEFG of things that affect us. And people like here, they may have more than one thing. You don't just have lupus, you can have high blood pressure is a big one.
Diabetes with it, everything.
All of that. People now looking for natural remedies of how not to have high blood pressure. And again, it all boils down to, your stress.
Exactly.
Being diagnosed with something like lupus may give you high blood pressure. Seriously. Because now you're stressing on every single thing in life, right? What do I eat? I don't want to get stressed. And do you ever notice that when you don't want to get stressed, you're stressed out more?
You're stressed out. Yeah.
You're stressed out from not wanting to be stressed.
Even when you eat healthy, you could eat perfect every day. Get your smoothies, get your calories, get your carbs, counting carbs and all of that. All of that means nothing if you have an ounce of stress.
Yep.
Stress,
true.
Stress
is a big factor.
Dr. McCray will tell you, for all of her patients out there, she will come in your hospital room and tell you, put that phone, turn that phone off. If you got a cell phone, turn that phone off.
I'll make it turn it off.
They're like, this lady don't even know me telling me to turn my phone off. I said, no, I'm so serious. She said, if that phone is causing any stress, turn it off. And she said, listen, the only way you will get out of here is if you are not stressing about anything. And I literally had to disconnect. Some people was like, well, why are you going live and you in the hospital? Because you can't post when it's for me. This is just me. I can't set this guideline for nobody else. You can't post when it's all good. I want my journey to be as transparent as possible. I want to take all of my followers and families with me on this journey. So I wanted them to see hey, I'm in the hospital and it's rough, it's hard. So with I'm sorry, my phone had clicked. But also with that, at that time, it was in a pandemic. We were in, I think, the beginning. And you couldn't have any visitors in the hospital. And that was lonely. Have my friends come up here. I can't have my family come up here. You can have one person, but nobody trumps my mama. So my mom gonna be my visitor. But it was just, okay, let me get them back into social media and let them know what's going on, because it's not all peaches and cream all the time. So I would say I was blessed with the family I have, but even more blessed with my care team, because Dr. McCray treated me like her own. Like, you're not gonna eat this. I remember I didn't want to eat, but all I wanted was apple juice. And I used to have them bringing that apple juice by the dozens until she came in of the UTI. I didn't get one, but she made sure I wasn't going to get one, because she was like, nope, no more apple juice. She asked y'all for apple juice, don't bring it. Bring her water. That's it.
I love apple juice. But that's a good segue to, before we close the show, because I think, you're blessed to have a tribe, Kiara. You have, like you said, your mom and your family, they help you, but everyone is not in that situation. Or let's just say they have people around them, but just simply don't understand the disease. Maybe they don't have education, or maybe they think you're not in that much pain, or or those stressors that people have, and they don't think that it affects their health. So Kiara, and then I'll ask you, Rashawn. Kiara, for people who are out there who have someone in their life who has lupus, how should they handle people that have lupus? What do you think are the main factors for your support team that help you get through it?
One thing, love on them.
Yep.
Don't ask them what's wrong. Don't ask them, are you in pain? Love on them. And sometimes that means just being there. Sometimes that means, hey, let's go do this. Sometimes that means sending them a text message, or, sending them songs, just love on them. I would say for anyone battling lupus or any disease, right? Have lupus and Sjogren's, but that's a subject for another time.
Yep.
Because I think sometimes too, when you're diagnosed and when people just don't understand, they handle you like with the white gloves, right? It's like sometimes they don't do it intentionally, but let's say they might count you out of something, but be like, we can't invite Kiara because she has lupus, or she might not like this because she has lupus. You know what I'm saying? Like, I want to break and I get it, because you mentioned something key. If I'm having an event and I know it's going to be an outdoor event, I know that the sun is not going to be good for you. However, I think as a good friend or family member, I should allow you to tell me I can't make it, right? Then just to assume and count you out because you have lupus. So that's what I'm saying. Like, those type of things I think need to be said a lot, because I don't know, some people don't intentionally mean to be, I don't even know the word for it. But I think more family members and friends need to know more about it, so they make people with lupus feel normal. But you do have those days where we, like you said, we need to love on you. So I think it's kind of like they work hand in hand, right? Would you agree?
Yes.
Yeah.
Roshan, what from a medical standpoint, are there any things that people for loved ones or caretakers, or just people that are in a person's life that has lupus, are there any signals that they may need to know and say, hey, she's not doing too good today? Like, she's having a day. Because sometimes people don't talk. They're warriors. They're not going to tell you they're not going to complain every time, because, you get used to pain. You're used to it. But there's that look that you have where you be like, here, she's not doing too good today. Right? She's having one of those days. Are there any red flags that other people need to know to kind of be a little more sensitive to their condition?
Just let that person be. That if they going through a flare up, or they have a moment of depression, they're depressed, just let them be. Just let them know, like she said, love, you're there for them. And if you want to talk, just let me know. A simple text, how you doing today? I'm there for you. Let me know if you want to talk. That's it. Because sometimes you never know what a person's going through. Do you want to walk with me on the beach? You would just walk on the beach, don't say nothing. Or I just come and sit at your house and just sit there with you. That's it. No words, nothing has changed. That's all. Just be.
That's good advice. I mean, I hope someone has learned more about lupus tonight. And I know, like I said, you ladies can go back in the feed and definitely still continue the conversation, because I know we had, Licia, she's one that has it very transparent. Greta Jones, I don't know if she's joined us. She's a friend of mine that has shared that she has it as well too. And I know you have those days that you're in the hospital and your loved ones are worried about you and your friends are worried about you. So I think that's another thing too, that we just have to know that you'll be okay. We have to have that, throw that in the atmosphere, especially, with caretakers like Roshan that's in there in the trenches.
Yes.
With lupus and COVID and everything known.
This my niece too. This is my niece now. I got me a niece when she came in there, so she's called me auntie now. So.
And I know that you see it all, Roshan. So I give you kudos too, because you see a lot. and got to come home and be normal. Because
yes, I do. It's like,
you discussed how many patients you lost just with COVID alone, and that's just one thing that we had to deal with. We got all this other stuff. So, like I said, ladies, keep me honest, keep us honest. Let's continue these health conversations, because it doesn't end after tonight, right? We're still going to have people that get diagnosed with new things. Some people are going to walk around and think, oh my God, now I have it. Maybe now we'll scare people to go get blood work. You may not have lupus, but you could have something else. Blood work is very important. And also too, I hate to say this, because no, I don't really hate to say it. I will say it because sometimes we need to say it.
mm-hmm.
We have doctors that we've been through with years, right? Doesn't mean they're great doctors. Just because you've been with them for years doesn't mean they're great doctors.
Exactly.
Every doctor that's a doctor is not a great doctor. I say, listen to your inner self. Don't let people tell you nothing's wrong with you. If you think something's wrong with you, get a second opinion.
Exactly.
Right? Get a third opinion. There have been many cases where people will go to a new doctor and all of a sudden their eyes are wide open because they realize they had all this stuff. Like I said, me being a hypochondriac, I go in and tell them what I want. I know that there are certain standards, and I know sometimes the insurance doesn't cover things if you don't have history. But I always say this: you could be the first one to start the history of your family. Just because my mom didn't have cancer doesn't mean I don't have cancer. So get those tests. I got my mammogram, and it was like 2-3 years old. I felt so bad. I'm like, well, it was COVID. I checked myself, and they were like, it doesn't matter. Thankfully, it's clear. But I'm telling you, ladies, especially our ladies. Go get yourself checked out, your mammograms, your pap smears, your blood work, your sugar, your high blood pressure, because unfortunately we carry a lot. I don't know why we do live longer than the men. I think that's statistically right?
Yes,
is that true?
we do. We live long. Yes,
they don't get checked. And the men who are watching the show, do not rely on your baby's mama, your wife, your girlfriend's test results to know that you don't have it. I love when men say that. Oh, I'm good. My baby mama good. Really? You got a whole set of different blood than her. Please. Let's not do that. We're not talking about just STDs. It doesn't just end with STDs. It has a lot. But we want to stay around longer, and we want to make sure that we're having these conversations to ring the alarm, is what I call it. It's ring the alarm. So it is still Lupus Month. Please, I'm sure Kiara does not mind you reaching out to her. And Kiara, when is it your official, I call your organization, when does it officially start, or has it started already?
I'm just starting to get off of the ground, but once it is official on paper, because that's when I say it's official, when it's in black and white, I will definitely, the world will know, because Kiara will definitely make announcement.
So are you going to be up for, and just putting this out in the atmosphere, are you going to be up for speaking engagements, interviews about lupus? Because again, we do get caught up in these months, just like Black History Month. And I always say it's just not 28 days in a year. We make history all year round, right? So when we come about mental health, it doesn't just Mental Health Month. I know we have these months, but we have to talk about this stuff 365 days a year, because every day, every minute, every second, someone is diagnosed with something. So keep these conversations going, so we can normalize the talk about it. Because I remember back in the day, no one talked about mental health. If you had a therapist, that was a secret. Like, girl, don't tell nobody you're seeing somebody. Right? Right? Now it's like, I got a therapist. I'm normal, but I still see somebody every week, right? So we talk about it enough. Now it's normal. So let's talk about these health issues to make them normal again, right?
I call it body talk. Always body talk, because your body is talking to you. Listen to it.
Oh, that's our new series. Body talk.
Body talk. Let's do it. Listen. And you're right, because it showed. Listen, it talked to me every morning when I get up. Back be like, wow. Back be like, girl.
Yep.
Be like, girl.
We don't listen. And a lot of times it's fear. Fear make us not want to do things. And just like with HIV, everybody thinks HIV gone. Still here. I still diagnose HIV all the time.
That's, again, that's why I said we have to come back. We can have a whole STD series and
yes,
have the whole UT, because UTI can fall into that too. I remember that used to be a category. They tried to put that in with you know, and a lot of men was getting stabbed because of that, you know, UTIs and STD. It's like, girl, you weren't drinking no water. That man ain't give you nothing. You weren't drinking no water. That's a whole nother show.
Make sure you urinate after you have sexual intercourse. A lot of people don't know that.
Yes, I heard that.
A lot of people do not know that. I have a lot of young girls, so definitely do that. Each time, every time, I don't care how tired you are, get up, go to the bathroom after that.
Okay, so pee after you give up the pee. I got it.
Yeah.
All right.
Yeah. I like that.
That was clean. That was a clean version.
Exactly.
All right. All right now. So we're gonna do this, guys, ladies, whoever's been watching. We are in continuous conversation. Like I said, we could do it quarterly. We just get out and let's do it, and we'll talk about it. Thank you. Do you have any final words, Kiera? Do you have any final words?
Yes, I do. This Saturday is my Fitness and Networking Lupus Awareness Edition event at Hearst Chapel. That's 1617 Silver Beach Road. I'm doing this with my wonderful partner, Gerald Hearns of Brick by Brick Academy. So we are having this event on Saturday. You can go on the Eventbrite link. I'll post it in the chat. There are only, I believe, 6 tickets left.
Oh, wow.
Yes, so it will be an amazing time. I have some giveaways. It will be a raffle for more giveaways, free lunch, free breakfast, about 20 vendors. So it will be amazing. And we have some surprises, but you have to be at the event to see what the surprises are.
Awesome.
And it's what time is it? This is Saturday?
From 11 to 3. So from 11 a.m. to 3 p.m. We are all the way live at Hearst.
You have a flyer, Kiera?
I do. I can post it in the chat when we finish.
Okay, so yeah, or you can send it to me. I'll just share it on my page.
Okay.
There's so much stuff going on Saturday. I know we have that 5K race in the morning. I gotta get up early. Oh my god. Anyway, I digress. But ladies, it's been wonderful. Thank you so much, Kiera. You know you're gonna keep your head up, keep your crown on, and hopefully you will not have any more flare-ups. I pray that you don't, because
me too.
Yeah, right. And I think it's possible. I hope it's possible. But I just want to commend you for being an ambassador for lupus and just being a brave warrior, giving other women hope who have not yet been diagnosed, and just letting them know that, hey, life does go on, and you wear it well. Just want to say
yes,
that.
she does. Yes, she does.
You wear it well. And thank you, Roshan. I know
You're
you've
welcome.
had a long day. We will talk very soon again. And again, if you are watching this video, please hit the share button. Just if you like the video, you learn something from it. I always tell people, it does not prick your finger. It doesn't hurt. It doesn't cost you anything. And you may save someone's life, honestly, because people are in denial right now. And they can see this show and say, hey, that alarm goes off in their head and say, hey, I need to go get my blood work done. You may save someone's life or make it a better one. So thank you, everyone.
Thank you.
Fun. With all our technical issues, it's been great tonight.
Good night.
All
Bye-bye.
Good night. Bye-bye.